Atherosclerosis. Atherosclerosis is the accumulation of substances, especially fats and cholesterol in, and on the artery walls. The risk factors of atherosclerosis include smoking, hypertension, diabetes mellitus, hyperlipidemia, cocaine use, increased fibrinogen, increased C-reactive protein, reduced HDL, and increased homocysteine level. Peptic ulcer. A peptic ulcer is a sore on the lining of the stomach, small intestine or esophagus. The patient presents with the following symptoms, remembered with the mnemonic, FAB time: fatigue and feeling fullness, abdominal pain and discomfort, belching and bloating, tender abdomen, ingestion, melena, and lastly, emesis or vomiting. Trigeminal neuralgia. Trigeminal neuralgia is a sharp-shooting facial pain, which appears sudden and severe. It is often described, like having an electric shock in the jaw, teeth or gums. It usually happens in short unpredictable attacks. Components associated with it are remembered with the mnemonic, neuralgia. Nature of pain, which is twitching. Eye care is compulsory. Patient prefers to chew on unaffected side. Room temperature is preferred by the patient. Physician assess nature of pain. Patient likes to eat lukewarm food. Oral hygiene is necessary. Increase protein and calories. And one should avoid touching the patient. Gout. Gout is a painful form of arthritis. This is when the body has extra uric acid, then sharp crystals may form in the big toe or other joints, causing episodes of swelling and pain. Although gout is treatable with medications, there are some drugs that cause gout. In remembering these, the mnemonic candle cap should come to mind. Chlorthalidone, aspirin, nicotinic acid, diuretics, levodopa, ethambutol, cyclosporin, alcohol, and pyrazinamide. Changes in ECG during electrolyte imbalance. Here is the normal, with the P-wave, QRS complex, T-wave along with their various segments and intervals. In hypokalemia, there are long PQ interval and prominent U waves. In hyperkalemia, there are peaked T waves. In hypocalcemia, there are QT prolongation, while in hypercalcemia, there is shortening of the ST segments. Hypernatremia. Hypernatremia is the medical term used to describe having too much sodium in the blood. Key signs and symptoms can be remembered with the mnemonic fried. Fever, which is low grade, and flushed skin. Restlessness, which is irritable. Increased fluid retention and blood pressure. Edema, both peripheral and pitting, decreased urine output and dry mouth. Status epilepticus. Status epilepticus is a seizure that lasts longer than 5 minutes, or having more than one seizure within a 5 minutes period, without returning to a normal level of consciousness between episodes. Its complications are remembered with the mnemonic, harass. Hyperthermia, aspiration pneumonia, respiratory arrest, rhabdomyolysis, arrhythmia, and sudden death. Mumps. Mumps is an acute self-limited systemic viral illness characterized by the swelling of one or more of the salivary glands, typically the parotid glands. Its clinical features can be remembered with the mnemonic, SOAP. Salpingitis, orchitis, euphoritis, and then aseptic meningitis and pancreatitis. Arsenic poisoning. Arsenic is a natural component of the Earth's crust and is widely distributed throughout the environment in the air, water and land. Arsenic poisoning is a medical condition that occurs due to elevated levels of arsenic in the body. Its features are remembered with the mnemonic, harmful cash. hemorrhagy, spots in mucosa, Addison-like disease, raindrop pigmentation, Mies lines on nails, fatal dose of 120 to 200 mg, cholera-like diarrhea, arsenic neuritis, subendothelial petechial hemorrhages, and hyperkeratosis of palms, which is thickening of its outer layer. Hypoxia. Hypoxia is a state in which oxygen is not available in sufficient amounts at the tissue level to maintain adequate homeostasis. The mnemonic for the signs is RAT. Restlessness, agitation, and tachycardia. Mercury poisoning. Mercury poisoning is the result of being exposed to too much mercury, either through the diet or environment. The mnemonic is smell black tea. Salivation, membranous colitis, lens deposition, black line deposits on gums, tremors, which could be intentional, erythism, and acrodynia, a condition of pain and dusky pink discoloration in the hands and feet, most often seen in children chronically exposed to heavy metals. Myasthenia gravis. Myasthenia gravis is a chronic autoimmune disorder in which antibodies destroy the communication between nerves and muscle, resulting in weakness of the skeletal muscles. Drugs that can exacerbate it. ABCDE. Aminoglycosides, which include streptomycin-like macrolides, and azithromycin-like quinolones, and then ciprofloxacin. Next is beta-blockers and botulinum, chloroquine and quinine, D2-curare and vecuronium, and lastly, magnesium. Cholestasis. Cholestasis is a liver disease which occurs when the flow of bile from the liver is reduced or blocked. Its symptoms are fever, chills or rigor, nausea and vomiting, anemia, loss of appetite, weakness, and muscle pain, swelling of the legs, dark color urine, and dark-colored stools, bone pain, pale and yellow skin or mucosa, fatigue and weakness, yellow sclera, hemorrhagic features, abdominal pain, and weight loss. Hepatitis treatment. The mnemonic is hepatitis. Hand washing, eat low fat and increase carbohydrates. Personal hygiene, activity restriction, that is rest, avoid toxic substance. Making use of individual bathroom, testing results to help with the accurate treatment regimen. Interferon, which is subcutaneous, and small but frequent meals. Exercise guide for diabetic fitness. Mnemonic is FIT. Frequency of exercise, which should be 3 to 4 times a week. Its intensity should be 60 to 80% of maximum heart rate. Time of exercise, that is, aerobic activity, should be 20 to 30 minutes, including warm-up, dance, running, etc. Alcoholic liver disease. Mnemonic is damp pages. Discomfort in abdomen, ascites or alcohol toxicity, muscle wasting, portal hypertension, palmar erythema, and polyneuropathy. Prolonged prothrombin time, abdominal pain and decreased albumin. Gynecomastia, elevated AST and ALT, and spider angiomata. Heat stroke. Heat stroke is a condition caused by the body overheating, usually as a result of prolonged exposure to high temperatures. Mnemonic is tired. Throbbing pain, irritability, rapid and strong pulse, restlessness, excessive nausea, vomiting, and unconsciousness, and finally, dry skin, red skin, with no sweating. Differential diagnosis of abdominal pain. Mnemonic is abdominal, appendicitis, biliary tract disease, diverticulitis, ovarian disease, malignancy, intestinal obstruction, nephritic disorders, acute pancreatitis, and liquor, that is, diseases associated with high alcohol consumption. Macrocytic anemia. It is a term used to describe red blood cells that are larger than normal, with low numbers of properly functioning red blood cells. Its differential diagnosis is remembered with the mnemonic FAT RBC. Fetus, that is during pregnancy, alcohol, in excessive cases, thyroid disease, specifically hypothyroidism, reticulocytosis, B12 and folate deficiency, cirrhosis and chronic liver disease. Hypersensitivity reaction. Hypersensitivity reactions are exaggerated or inappropriate immunologic responses occurring in response to an antigen or allergen. The word acid is used to remember the types: anaphylactic reaction, cytotoxic reaction, immune complex mediated, and delayed reaction.